for making such a warm welcome. And it's really my pleasure to be here today. I also want to thank my University of Waterloo colleagues. This is a group of us engaging in the Canadian pastime of ice skating, which we tend to do when the weather is very cold. Some of the research that I'm going to share today, they've been involved with, and certainly some of my thinking around these things, they have really helped to shape that as well. And I also want to acknowledge my PhD supervisor, David Hammond, who I know some of you know. And you know that you have a really good PhD supervisor when you and your parents spend several weeks making a custom doll as a parting gift for him. So that's the one and only Dr. David Hammond doll. And while I'm thinking of it, I should say hi to my mom and dad who are watching from Canada right now. So what's the difference between Canada and New Zealand? Well, there's the obvious size issue. And in a moment of panic when I was applying for the job here, I found out that Canada is 37 times the size of New Zealand. And Ontario is 4 times the size, in case you wondered. There are also differences as far as the population sizes, Canada having a much larger population. I understand, though, that we each have a neighboring country that can be a bit difficult at times. So we do have that in common. But we also have some similar health trends, and we've both experienced dramatic rises in obesity and diabetes in Canada over the last 3 decades. We've seen doubling and tripling of these conditions. And when we look at our comparator countries in the OECD, we see that as far as obesity rates in adults, for 36 countries, New Zealand comes in number 4, and Canada is not too much far behind at number 8. And it's not that much better as far as diabetes rates as well. Canada number 11 and New Zealand number 12. So we're really seeing this escalation of healthcare costs, and it reinforces the critical role for diet in health and disease prevention. And both countries, I think, are wrestling with strategies. What strategies can be put in place to really address these health issues? So it brings me to what we're going to chat about today. So I'm going to present a problem, and I'm going to focus on sugars and sugary drinks. This is not the only dietary health problem out there. It's not the only health problem out there, but it's one that certainly deserves attention. And I'm going to look at some work that was happening in Canada with trying to stimulate some action, some policy action around this health issue, and present a study there. And then one approach, which is taxing sugary drinks, is not the silver bullet. It really should be a part of a combination of policies and programs, but it is certainly one approach that looks like it can be effective for reducing consumption. Going to look at whether we've really kind of seen any progress in Canada, and then just a brief discussion on what this all means. And my hope is that even though that you work primarily in a New Zealand setting, that there'll be some takeaways for you, and of course reusing your reusable takeaway container. I'll just also mention that quite a bit of this work is under review right now, so I prefer if you didn't cite it, but if you're interested in using any of the results, just send me an email and we can chat. Okay, so sugars and sugary drinks. So why consider sugars and sugary drinks? Well, we know that sugars are a determinant of weight gain and cardiometabolic factors. We also know that sugar-sweetened beverages in particular, SSBs, the consumption is an important dietary risk factor, where high consumption contributes to excess weight gain, increases the risk of obesity-mediated disease, and then also has direct effects on disease risk. The WHO has recommended limiting sugars intake, recognizing the health impact associated with this risk factor. So we've got a situation where it's costing billions of dollars, lives are being lost each year. So before we look too much further at sugar, I think we need to ask the question, are we focusing on the right foods and beverages? So that brings us to the first study that I've been involved in that I'd like to discuss. And the main research question was, what are Canadians' top sources of sugar? So before we go any further, we also need to address what type of sugar we're talking about. So I'm going to give you a quick tutorial on different types of sugar. So we have total, added, and free sugars. So total sugars, these include natural sugars that you would find in fruits and milk. Added sugars, which is probably something we're all familiar with. These are sugars that are added during the processing of foods, and it includes syrups and honey that might be added. And sugars from concentrated fruit or vegetable juices. And then there's this new one that we're talking about more and more called free sugars. It's the same as added sugars, but it also includes sugars naturally present in honey, syrups, fruit juices, and fruit concentrates. So what does this actually really translate into as far as food and beverages? Well, total sugars can be found in a can of Coke, 100% juice, and an orange. Added sugars are found in that can of Coke, and free sugars are found in the can of Coke, and then also the 100% fruit juice. And what we're going to be focusing on with the studies I looked at is free sugars. So just to note, that includes 100% juice. The data that I'm going to be pulling from is from the Canadian Community Health Survey, the nutrition component, and this is a national dietary recall survey. So they asked people everything that they ate in the previous 24 hours. It was conducted in 2015, the previous one was 2004. So for those of you working in nutrition in New Zealand who are still working with old nutrition data, I feel your pain. So when we examined the data, what we found was that SSBs, so sugar-sweetened beverages, contribute the most free sugars to Canadians' diet. So looking at all the different sources of sugar, almost a quarter of the sugar that Canadians eat simply comes from sugar-sweetened beverages. And 100% juice is not too far down on that list, contributing about 11%. So together, just from beverages alone, Canadians get about a third of their sugar intake. So some people ask, well, why would you target beverages? Why not focus on, bakery products or confectionery or things like that? And the thing with beverages is that they really are discretionary food. We don't need to consume the can of Coke or other types of sugary drinks. It's something that we could probably remove from our diets pretty easily without there being too much loss of good nutrients. Okay, so what exactly is a sugar-sweetened beverage? So in this study, we defined SSBs, beverages containing added sugars. And it included all these different types of products. So some of them you'll see are ones that people sweeten themselves, but the vast majority are beverages that were sweetened during production. However, more and more people are using this definition of free sugars, which means that 100% juice would be included in that. And in our studies, we refer to sugary drinks as beverages containing free sugars and therefore would include 100% juice. So just in case you're wondering what we were talking about, that will give you a sense. So the second study is, what is Canadian sugary drink consumption? And is it going up or is it going down? And we used that CCHS nutrition data again. We found that as far as who is drinking sugary drinks, or SSBs, they're widely consumed by Canadians. The majority of people had consumed one on the previous day. 100% juice is the most widely consumed sugary drink. So out of those 17 categories of sugary drinks, 100% juice is consumed the most often. And consumption of both these beverage groups is highest among children. So let's look at the energy that can come. And so I converted all this from calories into kilojoules. So it makes a little more sense here. So we find that 100% juice contributes a lot of calories. So we have two categories here. We have 100% juice, and then we have total SSBs, which is all those other beverages grouped together. And while total SSBs is higher, you can see that juice is pretty high up there. But when we break out into those 16 different categories, we see that 100% juice is still really the highest in comparison in the Canadian context. And it's really about 4 beverages that contribute the vast majority of sugary drink energy. So we really see the importance of that juice, the carbonated soft drinks, flavored milk, so chocolate milk, and then fruit drinks as well. So what kind of change may have happened over time? We had that 2004 and 2015 health survey. Has it gone up? Has consumption gone up, or has it gone down? And the data shows that both juice and SSBs have significantly decreased. So 100% juice, it's decreased in volume as well as energy over that 11-year time period. And the same thing for sugar-sweetened beverages. We were seeing that reduction in volume and energy. However, it does seem like sugary drinks are more pervasive than ever. And are these numbers actually accurate? If you work in nutrition, you know that underreporting is a really common problem. People are really bad, not necessarily intentionally, but really bad at reporting what they eat and they drink. And there are studies showing that between the 2004 and 2015 surveys, Canadians have actually got even worse at reporting. So we're seeing an increase in underestimation. So one thing that we can do is to think about the different limitations of data sources. And actually, Christina Cleghorn and I are going to be doing a departmental journal club seminar, I think it's next month, talking about different ways of measuring diet. And one can also compare it to different types of data sources. So that's the third study that we're just going to very briefly look at. And it's looking at 3 different sources of nutrition data. And how do these 3 sources compare as far as sugar drink intake? So in summary, very briefly, what we found was that all 3 of the sources showed that sugary drink intake was decreasing, but at very different rates. So we use Euromonitor data, which actually the University of Otago also has access to through the Euromonitor passport. We used another proprietary data source called Global Data, and then we compared it to the CCHS nutrition data. And Euromonitor showed a 17% decrease in the volume. Global Data showed a 22% decrease. And CCHS Nutrition showed a 32% decrease. So they're all going down, but they're definitely going down at different rates. So I think that one of the takeaways that we had from this study was that there can be very significant differences in data sources depending on what you look at. So if you're relying on something like Euromonitor, or even if you're relying on something like nutrition data to kind of have a sense of how it might differ. So it certainly seems like sugar drink consumption has gone down, but does that mean that that's a reason to not necessarily take action? Certainly not when we think about it being a top source of sugar. So in Canada, despite the evidence, we seem to be a bit stuck as far as taking action on nutrition. I'm pretty sure that this is not photoshopped, but I could be wrong. And really trying to get some action rolling as far as policies and intervention was what a group of health NGOs were trying to do in Canada. So that just brings us to the next study. And I'm really going to present this study a bit more as a case study than necessarily get into the particular methods. So 5 health NGOs decided that they wanted to fund some research to look at the avoidable burden associated with sugary drinks. So if we eliminated sugary drinks from the Canadian diet, what kind of health effects would we be avoiding? And they approached my supervisor, David Hammond, about doing this kind of work, and he knew it was the kind of thing I was interested in, so I got pulled in as well, and it ended up being a big chunk of my dissertation work. The main research question, as far as the avoidable burden piece, was to look to quantify what is the avoidable health and economic burden of sugar drink consumption in Canada. It used simulation modeling. I don't think it was as complex as the work that Bo does here, but it's of a similar vein. And the work was presented in a report that was widely released in Canada. It was circulated throughout different media venues as well, and certainly the NGO partners that we worked with took leadership in distributing it. And the aim was really to try and put some concrete numbers around what Canadian sugary drink intake is, what kind of an impact is it having on health, and what kind of an impact is it having economically as well. So I won't go into the details. I'll just say that it contained the kind of numbers that can get headlines as far as the quantification of the different health and economic burden. And it certainly did get quite a bit of media attention. It was covered in the one of the national newspapers, so several of the national newspapers. It was covered over the news as well, on television. It got coverage in French Canada too. And the Canadian Beverage Association, which is the association responsible for lobbying for the beverage industry, certainly took notice of it also and made sure that their perspective on it was heard. So part of the research that we looked at was what kind of an impact would a tax have on Canada? We know what the health burden is now, but what kind of an impact could a tax have on health and economic aspects? And why consider a tax on SSBs? Well, we're seeing taxes being implemented in jurisdictions all over the world. The evidence that's coming out is that they're impactful, they're cost effective, they're also feasible. Seattle is one of many settings that have implemented one. And the work that I was doing subsequently was just to see what kind of evidence can we provide to help inform policymakers who might be considering implementing a tax in Canada. So let's get a little bit more. I'm going to go into the methods a little bit, but still kind of skim through. This was a focus of my dissertation work. The results, and an earlier version was presented in that report that had all the green bottles. And then I did an updated version when the new nutrition data was released, and that was part of my dissertation. So I'm presenting the dissertation results from my PhD. So the main question was, what is the health and economic impact of a simulated Canadian sugary drink tax intervention? To very briefly explain the model, it is a simulation model that compares two populations. You have one population without the intervention and one population with the intervention. It was the 2015 adult Canadian population. The way it works is that the tax will increase the price of beverages. That leads to decreased consumption. That decreased consumption has an effect on BMI, which influences 19 different diseases, and then also an indirect effect, a direct effect on type 2 diabetes. That then translates into different changes in diseases, and that relates to changes in healthcare costs. And then the difference between those two populations, one with intervention, without the intervention, is what we would consider to be the intervention impact. So there you go, a little bit more on simulation modeling for you. This is a model that we adopted from the Australian Assessing Cost Effectiveness model. Now, as far as the type of tax intervention that we modeled, we applied an ad valorem excise tax, and I'm just going to present the results for a 20% tax. The group of beverages I'm going to talk about is sugary drinks, so that includes 100% juice for the reason that Canadians consume a lot of juice. And when we did the results, we actually compared that SSB group to the group of beverages that didn't contain juice, just to show the difference. But for simplicity, I'll just focus on sugary drinks here. We used own price elasticity, which is just a measure of how much people change their consumption when the price goes up, their purchasing goes down, and this was from a meta-analysis. And then we also included cross-price elasticity of demand, so looking at how their consumption of other beverages might change as a result of the tax. Okay, and so just to review, this is the group of beverages that we taxed. So we didn't include anything where people sweeten their coffee or their tea themselves. And because we weren't really sure the reason people were consuming things like meal replacement beverages and protein drinks, we didn't include it. Sometimes people who are undergoing cancer treatment, who have real nutritional issues, are consuming meal replacement beverages. And so we didn't want to kind of assume that that consumption would be changing. So the simulation model showed that there were improved health outcomes, and this was modeled over 25 years. So reduced or prevented cases of overweight and obesity. Deaths were also postponed, and DALYs averted too. And these changes are really, they were greatest among males and young adults because they are the highest consumers of these products. To give you a sense of kind of the diseases that we modeled, this is kind of a grouping of them. And you can see diabetes in particular, as far as the cases averted, was pretty high. And then we also looked at economic components, so healthcare cost savings. We didn't do a cost-effective analysis like the work that Bode does, but we just looked at healthcare costs and also looked at how much tax revenue would be generated through the tax. So this work got media attention as well, including Jamie Oliver, who wrote a couple of opinion pieces that went into the newspaper, and there was quite a bit of a variety of media coverage. So what happened? Was there actually a tax that was introduced? Well, we know that the Ministry of Finance considered it and looked very closely. They surveyed different Canadians. They kind of weighed the pros and cons back and forth, but ultimately decided that they were not going to go ahead with it. So we're still working on it right now. But what other type of progress has been happening in the Canadian context? I'm just going to give you like a quick overview of what I would consider the good, the bad, the ugly, and then the just bizarre. So there's no way I could do justice to all the work that's happening in Canada around nutrition, but I'm going to give you like a quick overview. So the good, one thing that followed after the research that we did was that there was a lot of action at the municipal level. So for example, the city of Montreal moved to ban the sale of sugary drinks inside city venues. Quite a number of city councils voted to petition the federal government to implement a tax on sugary drinks, and they also looked at their own type of interventions that they might want to implement. The bad is that we still see this persistent food industry influence. Canada's food guide from 2007 has been criticized as really being the industry's food guide because it was notoriously influenced by food manufacturers. And so because we have this poor food guide, it means that the standard that we have for looking at potential nutrition interventions, is not very good. Like for example, the food guide, it recommends chocolate milk consumption despite the high sugar content. And we're still seeing industry influence as well. Like this picture on the right-hand side is the briefing binder from the Canadian Dairy Farmers Association. It was accidentally left on the floor of the federal Conservatives national meeting. And so someone scooped it up and then started analyzing the content of it, but really making clear efforts to try to get to the leaders and influence them because they can then shape policy. So all this stuff is like working behind the scenes as we're diligently producing scientific evidence. The ugly is that as far as beverage consumption in Canada go, is that not all Canadians have access to clean tap water. And this is a particular issue on native reserves in Canada. And it's been something that's been a chronic problem of Canadians who don't have access to clean water, even though Canada as a country has incredible resources of fresh water. It's something that the Liberal government right now, the federal level government, has been taking very seriously and trying to tackle, but it's really an ongoing problem and it comes up every time we're talking about beverage intake. There's this group of Canadians that don't even have access to tap water and therefore have to rely on sugary drinks and bottled beverages. The bizarre is how nutrition issues can become election issues. So this happened in the province of New Brunswick. So for those of you who are not familiar with where New Brunswick is, it's on the eastern side. It's about a third the size of New Zealand. And what happened was the government in office at the time, the Liberal government, voted to, they said they were going to ban 100% juice and chocolate milk from schools. Other SSBs had already been banned, but they said, look, we recognize that these are the most prominently consumed beverages anyways. We don't want them in our schools. Then election kind of came around. The opposing party that was running against them, which was the Conservative Party, said, no, well, actually, we want chocolate milk in schools. It's a good thing. It's good for raising money. And it became the center election issue. And unfortunately, the Liberal Party lost by 1 seat. And so now New Brunswick is in a situation where their kids are still going to be offered chocolate milk in schools. And they were actually going to be the first province in Canada to take that initiative. So I don't know whether or not there was money that was coming in from the beverage industry trying to encourage that, but or trying to stop it from happening, but it definitely happened. So with all that, I was kind of struggling with kind of how to pull it all together and what kind of conclusions would I come to from this research. And I really, rather than speaking to kind of specific research results, was just kind of speak to kind of the package of work and the experience of kind of conducting this chunk of work. I think it's really necessary to take a critical look at all beverage types when we're talking about which beverages to reduce. I'm less familiar with the New Zealand context, but I'm getting there more and more. But I know in Canada that if we want to tackle sugar coming from juice, we have to consider 100% juice, and we have to consider those flavored milks, because those are the beverages that are being consumed the most. And it means that we need to take the time to kind of look into these dietary patterns. I think there are also can be a need to consider alternative data sources, but also knowing the limitations. And in the situation where New Zealand does not have an updated nutrition survey, trying to look at other data sources as well, like perhaps Euromonitor, to try and look at more recent trends of what beverage categories might be going up and down, but kind of recognizing the limitations of those as well. Challenges with examining some subgroups. So the work we did in Canada, often one of the criticisms that would come up, sometimes from health researchers, but also from the beverage industry, is, well, attacks would be regressive. What's happening with low-income groups? Are they going to be paying a greater proportion of their household income for attacks? And we would love to be able to explore those research questions more carefully, especially using something like simulation modeling. But the challenge is just the data is not available. And another challenge is that we actually have a whole segment of the Canadian population that is not captured in our national nutrition surveys. So all the northern territories, those populations are not included in nutrition surveys. Anyone who lives in the provinces but lives on a reserve or a native community is not included in the nutrition surveys as well. So we've got these like gaps that are really unfortunately around where some of the key health inequities are. And I'd also finally speak to the importance of partnership, and working with those health NGOs in Canada made a world of difference as far as getting the research out there, as far as equipping them with the kind of numbers that they need to be able to do the advocacy work that they have. And they're in the kind of position where if they want to call up the Prime Minister and set up a meeting with his advisors, they're able to do that. And in Canada, at least for researchers, we don't really have that possibility. So looking at what their needs are and partnering with them can make a huge difference. So finally, one shameless plug for my own work. I do have a couple of research questions I'd be really interested in pursuing that would be great for an MPH dissertation student. So if you are a student, which I don't think anyone in this room is right now, but if someone's listening who's interested in doing this work, send me an email. Or if someone is interested in funding a student to do this, definitely send me an email. So that's everything. Thank you.
Well, thanks very much, Amanda, for a rich overview of that topic. So opening it up for questions now. And we also will have some questions from our online listeners as well. But starting off in...
It's on? Yeah, thanks, Amanda, for that. That was really interesting. I'm slightly gobsmacked at how many of these drinks people are drinking in their diets, like really quite gobsmacked, which perhaps is a reflection on their being puritanical. But I wondered whether there was an interesting advocacy opportunity to actually talk to people about how much in their own personal budgets they are spending on these things, which are, as you say, if you eliminated them from your diet, there would literally be no impact at all. Mm-hmm. Whether actually talking to people about how much money they would have to spend on other things like, I don't know, petrol to have carbon emissions or something, but you know what I mean. Whether that's actually something that's absent from your the advocacy strategy.
Yeah, I think that that's a really interesting idea. Yeah, I think that the approach the advocacy has taken so far has been to try to quantify that health burden specifically. And I think trying to emphasize the effect on children as well as being the highest consumers. People hate it when you talk about attacks. Hate it so much. And they also hate it when it sounds like you're telling them what to do. And my PhD supervisor, Dave, who has done years of work in tobacco control and has been doing more and more work in nutrition, he was astonished because when this work came out, people would go to the effort of looking him up, looking up his phone number, emailing him, calling him to kind of like yell at him about how like, I'm already spending so much money already, why do you want to do this to me? But I think that, yeah, there could be some interesting avenues, and I'll have to keep an eye out for some research that's looking at that.
Oz? Oh, actually,
Thank you, Amanda. That was very interesting and energetic presentation. It was nice to hear. We don't get enough comparisons with Canada, so it's great you're here. I was really interested in the fact that the government, this is the federal government or the state government, federal government actually looked to change the law on this and then backed away at the last moment, or at least Treasury backed away. Mm-hmm. Do you have an Official Information Act in Canada?
Yes, we do. It's very backlogged right now.
Yes.
Yeah.
It's not surprising. But I wondered if you'd thought about putting in an OIA request for the Treasury papers, because I think, as my colleague here, Libby, had just representing the PHA at the tax review, pointed out that the former Minister of Finance doesn't accept that there's any evidence that would support tax, and it seems to be something which they think is frippery. And so it would be really nice to know what was the arguments made and where they broke down. So.
Yeah, I think that's a great idea. Similar journalists are often, people from the media have done this in the past, and in fact the Liberal government had even looked the previous year into a tax, and I think it was the Globe and Mail accessed information on why they backed away from it through a Freedom of Information Act request. So yeah, looking at it again is a great idea.
What was the results of that earlier inquiry?
They question the evidence. They question how much people will reduce consumption. I think that the threshold for evidence for an economist can be different than for someone working in public health, and the economists look at, we're not really sure what the price elasticities are for Canada, how can we really be sure? It's not the same context. And I just think that the sense was that it was politically unpalatable as well.
Just as a matter of interesting contrast, I think with the recent cannabis laws, some provinces are taxing cannabis, aren't they?
Yes, they are.
Yeah. So
yeah.
That got through.
With glee.
Yeah, I was looking at your model. The only direct effect you had for sugar was for diabetes, but I think it's got other direct effects. I mean, gout is probably one that's a particular thing, and I was wondering about whether the model was actually a bit conservative and could have been higher. Another question I had was, I was really puzzled at the decline, whether that was also reflected in sales, or these are all consumption data rather than sales data, right? The three sources. And I'd just be interested in what, is it actually there, or is it just the reporting of it, and why the decline?
Yeah, so to answer the first question, yes, the model was probably conservative looking at the health effects as far as not including additional direct effects, like including those related to cardiovascular disease. So fortunately here at Bode, I get to do even more complex modeling. So maybe it'll make its way into the Canadian model at some point in time. The decrease, so the two sources of data, the Euromonitor and the global data, were sales data, but they're more aggregate, I can't even say aggregate, they're estimates at a higher level. They're not based on actual store transitions. They use an algorithm, I think, to kind of give an estimate of what the numbers are. And then the other number was consumption data. So the consumption data showed an even greater decline than what the sales data would, but we have that underestimating problem. Why has it gone down so much? Well, I think part of the reason is because it was so high to start with. So if you're starting with it so high and you drop a little bit, you have a long way to fall. Yeah, it's possible that there's greater awareness. I think that people have a much clearer sense of, oh, I shouldn't be drinking this, but I'm drinking it anyways. But I think that there's still a lot of misinformation around other beverage types as well. And people who are like going hard, having smoothies and things like that without realizing that there's not too much of a difference between how our bodies respond to a smoothie versus a can of Coca-Cola. So more work to be done.
Hi, thanks for that. It was really interesting. I was interested in the industry perspective because I know Canada has a register of lobbyists,
Yep.
whereas New Zealand doesn't, although we're a lot smaller, so you can kind of tell what's going on. Did that factor in at all when you're looking at kind of the transparency of how decisions were made?
I haven't done particular analysis around that. I know that there are other organizations, like for example, the Heart and Stroke Foundation, which is a lobbying group, but for health, that pay more attention to kind of who's coming and going. I think that the current Liberal government has tried to be much more transparent about publishing who is going in and out of offices. And some of the consultations that they've had, including around front of pack warning labels, they've actually, when they've had industry representatives there, they've televised them through like a web link so that the public can watch and other researchers can watch. So there's an effort, but yeah, it's still not completely apparent.
Andrew, maybe just a question about, you know, some of these taxes started in the US, and I think there's 6 US cities that have quite high sugary drink taxes. Was Canada learning from those jurisdictions when it thought about this option?
Yeah, I think that probably the coalition of NGOs was more influenced by the UK tax and the progress that happened there, and yeah, trying to replicate some of the efforts that were taken, like specifically quantifying the health burden and the potential impact of the tax as well. Yeah.
Okay. Any other questions? Ellen?
Hi, that was really interesting. I've got a question of speculation for you. You said that people have got even worse at reporting their consumption in the past decade, despite the increasing public knowledge about their problematic nature. Would you like to speculate on why this is so? Why has it got worse?
Speculate. I think that it's possible that our food source is much more diverse as far as the amount of energy. So for example, if you go out and you order some rice, it could be plain rice, it could be cooked with a bunch of oil, it can contain all these other things, and that's wildly different as far as the energy that would be in there. I think that people also, because of this awareness of foods that are unhealthy, are perhaps even less, they're more likely to want to underreport their consumption of some of these unhealthy beverages. And I don't know, it could be people eating on the go more, not paying attention to how much they're eating. Yeah, that's speculation though. But there have been studies, there was specifically a study that compared the 2004 and 2015 study that quantified the percentage of overestimation and underestimation, and found that people who overestimate, that had really gone down, and people who underestimate had doubled. So there's definitely, that's certainly a thought when you're comparing different years for nutrition surveys. And similar trends have been seen in the US also.
Any other final questions?
I was wondering if you experience here, where should New Zealand go with this?
I think the question was where New Zealand should go with a sugar tax. Well, I think that, like Canada, New Zealand would benefit from a tax on sugary drinks. How do you get there? I think certainly keep providing the evidence, trying to look at new angles of providing it as well. I think patience, and I think also trying to, if that's not possible, then trying to look at other measures that can be implemented in the meantime as well. I think that there's a need to respond to kind of the arguments that the beverage industry is putting forward, but I also think that we can exhaust ourselves as researchers trying to constantly address this because they churn it out a lot. So being strategic and, if possible, trying to answer with your research.
Maybe just adding to that, I think there's going to be a lot more evidence when the evaluations of the UK tax comes out, and that's a particularly well-designed tax.
Yeah.
And they also have the tying the tax revenue to funding school sports, and so how you use the tax revenue is an absolutely key issue politically, and if that can go to help children in various ways, I think I think the US evidence in other countries, you know, how you use the tax is absolutely critical.
Agreed. Yeah, yeah.
Oh, I think we'll draw the session to a close. So I'd like you to join me in thanking Amanda for a great presentation.